One of the segments of clients who come in to see me are athletes, and I would put in that same category my professional musician clients who are hunched and doing repetitive movements. But the athletes, they often really, well, the runners, for example, they just abuse the heck out of their legs. And almost all the runners who I know, they love to run and they love that endorphin rush, but afterwards they're not so good with the stretching. And so I get on my soapbox occasionally and emphasize that it's a good idea to do some stretching beforehand and after. But I've got a couple marathoners who I work with, and they pay me to do deep, firm pressure massage, separating the quadriceps and working fairly deeply to get blood flow to muscles that they have just used, and they're just as tight as a rock. Sometimes they feel like steel bands. Yeah, talking to the athletes about self-care with the stretching. In fact, many of my athletes who I work with have helped me learn the value of using cryotherapy, which is icing. In fact, one of my clients in particular who runs marathons helped me realize how I really needed to talk about ice and introduce ice as an option in my therapy. I personally really dislike being cold. However, from a therapeutic standpoint, ice is one of the most effective and affordable therapies to use. And so like I say, because of one of my runners, she's helped me realize that the icing that she does for her legs, afterwards she's able to continue and recover basically in a day instead of 3 days after a long run.